introduce Rebecca Davis, who is an associate professor of professional practice and director of the Center for Global Social Work at Rutgers University School of Social Work, where she teaches social work practice and global social work courses. In addition, she supervises international field placements and directs international education abroad courses. Dr. Davis is a consultant for child protection systems strengthening in sub-Saharan Africa and the former Soviet bloc countries. Her most recent international projects include the development of social work curricula for certificate and diploma programs in Malawi, case management guidelines for Swaziland, and a case management toolkit for evaluating child welfare case management services in the former Soviet countries. Dr. Davis is a licensed clinical social worker in New Jersey and North Carolina with considerable experience in direct case management practice and supervision. Dr. Davis. I should say her bio is much longer than that. Her work experience is phenomenal. You really should talk to her afterwards.
Because I'm really old. Okay, so my remarks are, I guess, more reflections on case management, and I'm really speaking from my heart because I am a case manager. I've done a lot of case management, and I think the key is, what can we do to change practice? It's really about changing practice on the ground. So I'm going to talk about the referral pathways and case management, but mostly reflect on case management and some of my experience. So case management, in my experience, is often seen as requiring lower level of skills. It's a generic practice. There's steps that you go through. But it's often seen as the person who makes referrals to the person who knows what to do. So I'm the middle person. So I'm pulling together all the experts. And often it's thought about, you think of it as doing eligibility for services, finding food, finding housing, getting medicine. But the question is, just what is case management? Or I guess I can just do this. And I like the definition that's in the guide, and it comes from the For Children kind of a conceptual framework, I think, that they have. Case management and referral mechanisms are the glue that binds populations affected by HIV with services. So it's the glue. So I was thinking, what is the glue? What's the sticky stuff? What makes it up? And so I thought about this. To me, the glue is the knowledge and skills in systems and processes. One of the primary roles of a case manager and a social worker in general is setting up and organizing processes for decision making. You're putting together the process. You're not answering the question, but you're trying to find out you're trying to find out what the different questions are in kind of a group decision making process, or at least in principle. So I see case managers as doing these processes. You're engaging, you're supporting, you're facilitating, participating, leading. Sometimes you're pushing and pulling as well. Guiding, referring, networking, advocating, managing, empowering. And this to me is what the glue is. But really the common thread through all of these processes is the relationship. And both that's the relationship between the clinical pieces, the family, the community. You can't do any of these without having that relationship. So the case manager needs to have a relationship with the child, any victim, any family member, caregivers, with the judge, the doctor, with the teacher, with the agency people, staff with any of the networks. So in some ways, to me, the case manager is the one that has that hand that helps people go through the system. And you can have all the steps here in the guide: introduction and engagement, intake and assessment, case action planning, all the way through to follow-up. But sometimes it still takes that human body, that human person, that warmth to really take you through that system. And I think that's really what case management is about. And in actuality, I think case management is much more abstract than concrete as well. So the knowledge base that case managers really need including the relationship, but also looking at practice through this trauma lens, really understanding trauma, understanding the implications of gender. So we call trauma-informed, gender-sensitive practice. So just what is it? This is a whole kind of movement around child welfare services to include trauma-informed, trauma-focused child welfare services and also case management. So basically, why is it important for case managers to have this knowledge? They will not provide clinical services. This is often what I hear. But in fact, there's a clinical side to case management in terms of the relationship. I've heard social welfare officers, case managers say, I can't help him or her because I'm not a therapist, I'm not a specialist, and we don't have those services. I can see you smiling, yes. And so often what I find is case managers feel disempowered because of the low status and low profile. And so I think one of the most important things we can do is really empower case managers. And I think it's key to effective case management practice. So basically, an informed case management services incorporates an approach that recognizes that behaviors and responses are expressed by children and caregivers are potentially related to traumatic experiences. It also suggests that we're sensitive and pay attention to stress, anxiety, and trauma. And also are careful not to re-victimize. So these are very important things that case managers need. So what can social workers or case managers do if we're using a trauma-focused lens? I think that there are basically 4 that are clinical in nature, because we have to be prepared to do a clinical assessment in terms of trauma. We also can be an educator in terms of helping caregivers understand that the problems they're experiencing may be reactions to trauma. If somebody's depressed, if they're aggressive, if they're withdrawn, that this is a behavior. So you can be an educator. We can also educate caregivers about triggers. So these are all clinical components of case management. And also have them participate in the planning. But I also think there are a couple of demand sides in case management. And that is really being an advocate and also advocate for access to specialized services and really working to build that network on the ground. So I say they're clinical and those demand sides to case management. Needless to say, I think it's a very important job. Thank you.
Thanks.